My name is Nestle. What's your name?
My name is Elizabeth Smith.
How old are you?
I'm 28 years old.
Do you live in Kursk?
Yes, I live in Kursk.
Address?
Radisheva Street.
Kwartier or hostel?
Kwartiera.
The number?
28.
Okay. When were you admitted?
I was admitted this morning.
What were your complaints?
Nurse, I'm suffering from severe diarrhea.
How often and when did the diarrhea start?
This morning I went 4 times and it started early this morning.
Okay. Alright. Okay. Now I'm going to check for the skin, inspection of the skin. Can you open your mouth? Stick out your tongue. Okay. Mucous membrane have a normal pinkish color. There's no ulcers or bleeding. I'm going to check for skin elasticity. Okay. Normal skin elasticity. Skin looks moist. Now I'm going to check for capillary refill. Capillary refill is negative. Now I'm going to check for vital signs. First, the temperature. Okay. Continue with blood pressure. The blood pressure is normal, 120/80. Temperature is normal, 36 degrees Celsius. Okay, going to check for pulse rate. Pulse is normal, 74 beats per minute. Okay. I just checked for respiration rate. 18 per minute.
Greetings. My name is Konstantin Monastyrsky. I am an expert in forensic nutrition and the author of Gut Sense: How to Reverse and Prevent Constipation and Irregularity in Children and Adults. People often ask me this question: Mr. Monastyrsky, what exactly are normal stools? Well, the normality of one's stools is determined by comparing them to the Bristol Stool Form Scale, or the BSF scale for short. The Bristol in the BSF refers to the Bristol Royal Infirmary, a hospital in Bristol, England, from where the scale originated. It is a self-diagnostic chart designed to help skittish patients discuss this delicate subject with their doctors without getting embarrassed. This is essentially what the Brits call getting the royal treatment. You just look at the picture, point to what approximates the content of your toilet bowl, and your doctor tells you whether your type is good or bad. Type 4 and 5 are considered normal. I provide a detailed explanation and what to do to get your own type in order on this page. Also, if you are a parent or a guardian of a young child, use this chart to fix minor problems well before they become a major headache for you and a source of long life trouble for your child. Good luck.
Diarrhea is the condition wherein frequent passage of loose, watery stool occurs. Diarrhea can be defined as absolute or relative diarrhea. Absolute diarrhea is the occurrence of more than 5 bowel movements a day. Relative diarrhea is the unusual increase in the number of bowel movements in comparison to an individual's usual bowel habits. The types of diarrhea according to severity are acute diarrhea, chronic diarrhea. Acute diarrhea is a type of diarrhea that usually lasts a day or two and heals on its own. Acute diarrhea is most commonly caused by infection, which can be viral, bacterial, or parasitic. Certain medications can also cause diarrhea. Diarrhea that lasts for at least 4 weeks is termed as chronic diarrhea. Chronic diarrhea is commonly caused by a functional disorder such as irritable bowel syndrome, infectious diseases, an inflammatory bowel disease such as Crohn's disease, colon cancer, a recent abdominal surgery, severe constipation, carbohydrate or fat malabsorption, endocrine system malfunction, or abuse of laxatives. Diarrhea usually starts with crampy abdominal pain followed by frequent passage of loose stool. Diarrhea with an infectious origin may also experience such symptoms with the addition of fever, loss of appetite, vomiting, weight loss and dehydration. Complications of diarrhea can be dehydration, electrolyte imbalance, and irritation of the anus. Diarrhea is usually treated with frequent and sufficient fluid intake. If necessary, oral rehydration solutions, or in severe cases, intravenous fluids administration to prevent dehydration. For adults, medications such as anti-motility medications can be used to relieve the symptoms. However, in cases such as bloody diarrhea, these medications are not advised. In that case, antibiotics may be necessary, which are prescribed by a physician. Furthermore, it is important to visit a physician when you have severe diarrhea after or during a visit to the tropics. Diarrhea is preventable, and here are some of the things you can do to avoid it. Washing your hands is by far the most effective way of protecting yourself, not only from diarrhea but other diseases as well. Clean every surface that will come in contact with your food. Do not drink unpasteurized milk or milk products. Avoid eating raw fruits and vegetables unless peeled or thoroughly washed. Do not eat meat or shellfish served cold. Stay away from eating street foods. Your general practitioner can give you more information about the disorder and its possible treatments.
The final stages of food digestion take place in the large intestine, or colon. After nourishment is extracted from what we eat, the leftover waste material mixed with water flows from the small intestine into the colon. After entering the colon, stool loses water as it travels upward through the ascending colon and across the belly through the transverse colon. As water is lost, stool returns from a liquid into a solid as it goes down toward the rectum in the descending colon. Stool is moved through the sections of the colon by waves of squeezing muscles in an action called peristalsis. Constipation can occur if too much water is absorbed from the stool or if peristalsis is slowed down. Many other factors can also play a role, such as a poor diet low in fiber, emotional stress, or other medical conditions.
Patients with gastrointestinal diseases often suffer from symptoms like frequent belching, appetite changes or loss of appetite, excessive thirst when the patients are maybe dehydrated. They can also have a fruity smell in their breath form, which could either indicate diabetic ketoacidosis, or they may have ammonia smell, which is suggestive in kidney failure, or they may have feces breath smell, which is often seen in bowel obstruction. They can also complain of indigestion. They might also have excessive gas flatus, or they could either have nausea, vomiting, choking, abdominal distension. Most frequently, patients also suffer from oral or rectal bleeding, which is mostly observed in ulcerative colitis, hemorrhoids, rectal cancer, diverticular colitis, or sexually transmitted diseases, or maybe the use of non-steroidal anti-inflammatory drugs like aspirin. This is mostly some diseases for rectal bleeding. In oral bleeding, the causes could maybe be gingivitis or oral cancer. The patients might also complain of fresh blood on dressings when it's maybe a post-operative case, and the nurse should observe for the color of the bleeding, maybe for the amount if possible. It could also be internal bleeding, so it would be suggestive to check for the patient's hemoglobin in the blood. Patients could also have jaundice, or they could either have dark urine in dehydration, or in patients with post-operative drains. It is very important to check for the amount and the character of the drainage, and also to check for the input and the output balance within 24 hours.
Здравствуйте.
Как вас зовут?
Меня зовут Элизабет Смит.
Сколько вам лет?
Мне 28 лет.
Где вы проживаете?
Я живу в улице Радищева, дом 5, квартира 28.
Когда вы поступили в больницу?
Сегодня утром.
Какой у вас жалобы?
У меня есть понос.
Когда он начинался?
Сегодня утром.
Сколько раз?
4 раза.
Сегодня?
Да.
Окей. Язык. Откройте рот, пожалуйста. Кожа в рот нормально. Вам трудно глотать или жевать?
Нет.
У вас боль в животе?
Нет.
Вы хотите пить?
Да.
Какой у вас аппетит?
Нормально.
У вас есть точно рвота?
Нет.
Нет. Можно измерить давление? Температура тоже? Давление нормально, 120, 80. Температура нормальна, 36 Цельсиус. Пульс. Pulse normal, né? Você me disse, e частота дыхательной, você me дisse. Можно посмотреть кожу? Кожа нормальна и температура под кожей нормальна тоже.